disorder affects one.
I remember this one girl who was really mean, and she just had lots of friends and her army of people. And I remember her calling me fat and ugly, and it was sad. And so I kept that in mind, that I was fat. I listened to what she said, and I decided to start losing weight. So I decided to not eat as much, and I would eat like a few vegetables every day for breakfast, lunch, and dinner. And just like that, I lost weight. I dropped 10 pounds a week. I got from 110 pounds down to 50. I was insanely skinny, and that's when I thought that I had an eating disorder. But I didn't want to stop. Every time I looked in that mirror, I always thought to myself, oh my gosh, you're so fat. Lose some weight. That thought in your head that is telling you, oh no, you're not fat. No, you're not fat. Don't, you got the eating disorder. It's like telling you, but then that one thought that's like, oh, you're so fat, you're so ugly, that reminds you of that bully girl. That just kept happening to me. So then I just started losing weight. And then one day at school, I collapsed on the floor during chemistry class. And I don't know what happened, but next thing I knew, I was in the hospital. They started feeding me with needles and tubes, and I was just terrified because I didn't want to gain any weight because I thought I was still fat. So then I gained weight. So at school, I got a group of friends, and then they always told me, oh, you're not fat, you're not obese, you're not ugly, you're perfect just the way you are. That just made me so happy. I was back to normal. Now I'm perfect. I regained my weight. I'm now a normal high schooler. I just want to tell people, just be yourself. And you don't have to lose weight. You don't have to kill yourself, basically. You are you, and you are perfect.
Anorexia nervosa is a psychiatric eating disorder that is characterized by a person who refuses to maintain minimal normal body weight, and it's usually because they have a disturbed body image of themselves. So a person without the disorder, like myself, when I look in the mirror, I see me the same way that you see me. But when a patient with anorexia nervosa looks in the mirror, they don't see themselves as we see them or as others see them. They see themselves as someone who's morbidly obese and very big and fat. So this causes them to constantly starve themselves or try to lose weight. Some people may wonder why anorexia is even a disorder, because it may seem as though it's common sense. If you're hungry, just eat. But this is not the case with these patients. People with anorexia nervosa have extreme psychological issues. So although they know that they should eat and they are experiencing hunger, there's something in their head telling them, don't eat, you can't eat. If you eat, they have consequences. And it's something that they really cannot help. As the young lady that did the story in the clip I showed you guys earlier, she explained how that felt for her, how she heard someone saying like just eat, but she also heard someone saying, no, you're very fat, don't eat, lose weight. Characteristics and signs and symptoms of this disorder include severely restricting diets, excessively exercising, binging and purging, which is when they will eat a lot and then they will try to throw up, or they will take laxatives or diuretics to try to empty their system. Though this is mainly seen in bulimia, it can also be seen in anorexia as well. Depression is also another symptom that usually comes along with anorexia. Patients can lose up to 25 to 30% of their ideal body weight due to muscle and fat depletion. This causes patients to develop cachexia, and they will have a cachexic look to them. I will insert a clip of what a patient with cachexia looks like. that causes the body to basically waste away. And this is why you see that the patients with cachexia look so skinny and they basically look like they're just skin and bones. The etiology of anorexia nervosa is not very well understood. It is still unknown, mainly because it is really just a psychiatric disorder and we really don't know how people develop it or where it comes from. The epidemiology is it usually affects younger women, usually in their teens or young adults. Anorexia nervosa may be more prevalent and include dancers such as ballerinas because they tend to be very thin, cheerleaders, models, and also someone that has been body shamed about their weight, or if they were obese and they did lose the weight, they can become addicted to losing that weight. And they also can get a disturbed body image of themselves because they have been obese. A BMI of less than 17.5 may indicate anorexia, but it is mainly diagnosed by 3 missed consecutive periods in women. Complications of anorexia nervosa include protein deficiencies, hypoglycemia, anemia, and vitamin deficiencies. So patients with anorexia nervosa can go into metabolic acidosis, and this can lead to cardiac issues, which is how most people with this disorder end up dying.
So to further explain the complications of anorexia nervosa, I have shown here a diagram which basically points out some of the key parts of the body that are affected. Starting with the brain undergoes atrophy, which causes changes in the way the brain functions, and this can be known as a starved brain. And it is thought to be the cause of depression, as well as some of the other things you see on the picture, which are headaches, fainting, dizziness, mood swings, and anxiety. Then they talk about the hair and the skin and also the nails, which will obviously have some changes due to the patients not eating the proper nutrients that they need to grow their hair and nails properly. They also talk about a yellow complexion, which is known as hyperkeratinemia, and we're not really sure why they get that. And then they also talk about how they have hair all over their body, which is known as lanugo, and they gain this hair growth because their body is trying to compensate to keep the heat in since they're so skinny and they're not eating. The heart tends to be one of the most affected organs in anorexia nervosa. The heart also undergoes atrophy, and this mainly affects the left ventricle. Patients can experience mitral valve prolapse, pericardial effusion, sinus bradycardia, and reversible sinus node dysfunction, as well as orthostatic hypotension. These can all lead to sudden cardiac death and heart failure. When talking about the blood, anemia is a very common and obvious complication of anorexia due to the patients not eating, so they're not taking in the proper nutrients to maintain healthy or normal blood levels, but it is specifically caused by serious fat atrophies in the bone marrow, which inhibits cell growth. So along with anemia, they can also have leukopenia and thrombocytopenia. As a result of the malnutrition and them just not eating and losing all the weight, their GI tract tends to slow down and they can develop gastroparesis as well as constipation. They also can have diarrhea, and this is due to the changes in their small bowel. We know that they will have hormonal changes because anorexia is diagnosed by 3 absent periods in women, and this is the body compensating for the anemia and the malnutrition. So if they already do not have adequate amounts of red blood cells, they won't bleed. As I mentioned earlier in my video, vitamin deficiencies is one of the key complications of anorexia, and that leads to electrolyte imbalances. This in turn disables the kidneys to function properly and remove toxins from the body, which can lead to kidney failure. Also relating to the vitamin deficiencies, they will have a loss of calcium in the bone, leading to osteopenia, and this will lead to their bones being very fragile and brittle, which puts them at risk for fractures. And lastly, relating to the protein deficiency that I also mentioned earlier, which causes the muscle loss, which leads to weakness and fatigue.
There really is no treatment for this disorder because it is a psychiatric disorder. Therefore, these patients need counseling and supportive care. If they're in a bad state of metabolic acidosis as one of the complications, they will need to be hospitalized, and as a nurse, what you would do is continuously offer them food, and the main goal would be to get them to a normal body weight. These patients also need reassurance They need reassurance that they're not fat and that they're not obese, and this tends to make them feel better and can help in the treatment of anorexia nervosa. Thank you for tuning in. That is all I have for you today about anorexia nervosa. Hopefully you learned something new.